Good afternoon, everyone. This is Dr. Famuyiwa, your host of Fertile Talks. And today we're going to do something exciting. I have with me in the studio a wonderful, famous doctor, Arredondo. He's known to Paco, as all of his friends know him, and he insists we all call him that. Um,
Yes.
Excellent. Thank you so much for coming to be with us today. I'm going to tell you a little bit about Dr. Arredondo, Paco, and then I'm going to let him talk about himself. So he is very famous in the fertility field. He has founded several clinics in the past and he was the original founder for RMA, Texas, correct, Dr.
That is
Arredondo?
correct. Yes.
Yes. And he was in charge of up to 50 physicians, a very good undertaking. And he's been a mentor to a lot of doctors. He's one of the pioneers and frontiers of medicine. But what I like so much about Dr. Arredondo is the fact that he also believes that physicians should be able to lead the business side of medicine. And to that end, he wrote a book called Medicalpreneur. I encourage you guys out of curiosity to read it. It's a good way to get your mini MBA on board. I've read it. I'm excited by it. I even shared it with some of my staff. Now, as if that was not enough, he couldn't get enough of this. He came back and he founded Positive Fertility
That
in
is correct.
Texas.
Yes.
Yes. And you now have two locations.
Going for the third one.
Oh, wow. Awesome. So, without much ado, I'm going to let Dr. Arredondo tell us a little bit about himself, and then we'll get into the meat of this conversation.
Hey, thank you very much for that wonderful introduction, your kind words. Um, I obviously I have to ask you what would be the best way to address you. Your name, Olu? Olu
Oluyemisi, Olu,
Oluyemisi. Olu. How do
Oyemi,
they call you Olu? I suppose Oluyemisi. Okay,
Yemi.
Oluyemisi.
Yemi is
Yemi,
fine.
Yemi.
Yes,
Okay.
absolutely.
Perfect. Yummy. So,
Thank you.
um, thank you very much for the introduction. My name is Paco. I am a fertility physician. I graduated from medical school in 1990.
Awesome.
1990. And the reason I am in this field is because in 1989, when I was a medical student in Monterrey, Mexico, I actually,
Mhm,
one of my mentors, Dr. Pedro Galache,
mhm.
he is a very, very good teacher, and he really instilled the reproductive biology in a lot of the students.
Excellent.
And he was in the team that achieved the first IVF baby in Mexico. So at that
Wow.
time, I was working on the andrology, on the sperm, and this and that, and
Yes.
I just got hooked. So when I finished medical school in Mexico, in Mexico you have to do like 1 year of for the government for free. So I did a research in Mexico City on a
Awesome.
WHO place where there was reproductive biology. It was the fertility side, but also the contraceptive side, and
Yes.
I had a lot of fun and learn. And then I said, no, I really want to go to the United States because my school had an exchange program with Baylor
Program.
here in Houston.
Awesome.
And
Yes.
so we spent some time here. And I said, I want to go to the States. And I really want to do OBGYN. I don't want to do anything else. So I went to New York and I got a 1 year transitional year in Mount Sinai. Then I went to San Antonio, Texas, where I did my uh, OBGYN residency. And then for my fellowship, I went to UPenn. And
Awesome.
in UPenn, it was a very good team. I was one of those last 2 year fellowship programs. And while I was there, in front of HOP, the Hospital of the University of
Right.
Pennsylvania, is the University of Pennsylvania, so it was Wharton. And I got very,
Yes.
very attracted to attending audition classes for marketing and cost analysis and negotiation and things that usually physicians do not like to do. But I always
Exactly.
liked them, and that opened my mind. So after that, I got an award from the ACOG, and paid me for 1 year to do a master's in public health in Harvard. But I actually focus it on healthcare management,
Awesome.
and so a lot of the management areas of public health. And once I finished, I had the opportunity to go back to Mexico or through the waiver program to stay in the United States, but I had to go to an underserved area. So I went and worked 4 years in rural Kentucky.
Wow.
And it was a small town of 5,000 people. Our community was 60,000. It was a small hospital, but I was lucky enough. It was the Appalachian Rural Healthcare,
Right.
ARH, and they had like 7 hospitals, and I was in charge of the women's health program. So I learned a lot about management and did a lot of OBGYN, general OBGYN.
Awesome.
After that, I was an assistant professor in Case Western Reserve University in Cleveland. It was a good time, 4 years. When I hit my 40th birthday, I said, I really know I'm an entrepreneur. I like to take risks. So I came to San Antonio, and in San Antonio, till this day, there's only one physician, fertility specialist that speaks Spanish, and that's me.
Oh,
So
wow.
being 67% of the population Hispanic, I thought it was a no-brainer. And I had a lot of friends and referrals, go from friends and this. And then from there, I moved as an assistant professor to Case Western Reserve University. And when I got there, I said, no, you know what? I'm an entrepreneur. I really want to go to San Antonio. And so we opened RMA of Texas, and we grew it. And we grew it from 3 people to RMA of Texas, Austin. And then we
Wow.
created McAllen. We opened Smart IVF, simple, mindful, affordable reproductive technology, Smart. And we sold 51% of it to Inception. I became the chief medical officer. And then we did a second merger with Inception to in Prelude, and became like 19 centers. And in 2020, in January 7 of 2020, I basically left, and I was supposed to be
Mhm.
writing a book and taking some time off, but then pandemia hit. So
Yes.
I just stayed in San Antonio and wrote the book. It's called Medicalpreneur with a K, Medicalpreneur,
Yes.
which is the
Yes.
official guidebook for physician success in business. And while I was doing research, I learned about the lean management and Toyota production system. And I say, well, how can we remove things that do not add value from the process of IVF? So
Right.
Positive came into being, and Positive has a very, very clear vision. We
Hmm.
know that what is our clear vision is having a healthy child is a universal human right. And
Right.
therefore, it's very clear what we're doing, trying to lower the cost, increase the outcome by creating more value, because the value can be created by increasing the pregnancy rate, the outcome, or decreasing the cost. So those are your 2
Exactly.
levers. And we have
Yes.
been able to decrease the cost of IVF by 50%, and with exactly the same
Awesome.
quality, with exactly the same uh, um, results. And we were lucky because in the first year we were profitable. We had a lot of people knocking at the door. We raised money, so we raised $20 million to open 3 more clinics, and we opened Houston. We 1 year after we received the money, and 2, we opened the IVF Academy. The IVF Academy has 3 branches, has a clinical branch, has a
Right.
laboratory branch. So we train embryologists, andrologists, nurse practitioners, PA, and the business side. So we train people in the leadership and listening skills, empathetic listening skills, how to build teams, etc., and all the business aspects that are touched upon the Medicalpreneur book.
Yes,
And
absolutely.
that's
That's
where here.
critical because, I mean, when we go to medical school, it's almost like the word business or money was almost treated like a dirty word, right?
That
So
is
you go
correct.
out there doing clinical practice. How do you even charge? What do you charge for a speculum? What do you charge for an exam?
Yeah.
You don't know, right? How much do
Yeah.
you
No.
pay for rent? And, how much do you pay for malpractice? They don't teach you that, right?
No.
And we
Let
all go
alone
into
that.
medicine. Yeah.
And let alone
Go
that they
right
don't
ahead.
teach us that. They don't teach us basic things like leadership, how to build a
Exactly.
team, how to
Yes.
hire people and how to fire people. They don't teach you
Yes.
operations management. They don't teach
Yes.
you cost analysis. I mean, they don't
Yes.
teach you listening skills.
Yes.
So there are things that are so basic to human being. It doesn't matter which profession you have, but the whole aspect of medicine nowadays, I must say that they are making big changes. My daughter is in second year of medical school here in Baylor in Houston. I'm in Houston right now,
Awesome.
and
Congratulations.
um, they actually teach her. They had a one class about Toyota production system, all the stuff, and she was like, "Oh, lean management, listening skills, acting skills, to be empathetic." And so
Yes.
it's like, oh man, I wish I would have had all this. So they're catching up, I think, and rightly so. So I give them credit for that.
That's good. That's good. Um, that's fascinating that you're doing all these things. I really admire it because even for someone like me that's been in private practice for over 20 years, it's just now that I'm
Hmm.
starting to hone my business skills, right? And I think you and I had a conversation where we talked about the influx of AI, right? And that's
Hmm.
a wide avenue, so that that's something where, if you don't know, you need to know, and you need to incorporate it. And it's just making us better, right? We're not being
Yes.
replaced, we're being better, we're being more efficient.
That's
And that's the whole
yeah, I think
crux of it.
yeah. Yeah, that's
Yeah.
very important that some of our colleagues do not feel that because we want to be more efficient and we want to use all this
Yes.
technology,
Yes.
we are going to be replaced or this. No, that will
No,
be
not at
that
all.
attitude
We're being better.
comes out of fear instead of the
Yes.
self confidence that we can do better.
Yes.
So yeah,
Yes.
that's
And
the
that
whole
I'm
thing.
going to segue into the meat of today's talk is, you and I talked about HyFoSy, right? Or HyFoSy, however, by XM
Yeah.
Foam. And I know that you're
Yes.
an expert in this. You've been using it. We're starting to incorporate it
Yeah, we've
in our
been.
clinic, and we want to offer it to all our patients. So I thought, you know what? Let me talk to the world expert on this technology, called HyFoSy, by XM Foam.
Yeah.
So can you tell us
And I'm
briefly what that is?
yeah. And I tell you a little bit of story. So I was in Case Western Reserve
Yeah,
University in
yeah,
2001.
right.
And I said, at that time, I said, why are we doing still HSGs? I mean, this is painful. This is uncomfortable. This is
Yes.
radiation. And at that time, there was a lady called Caterina Exacustos.
Hmm.
She is in Rome. And she was doing at that time with EcoVist, the one that they use for the heart,
Right.
EcoVist,
Yes. Yes.
and with a 3D software. And I said, so I flew to Rome and I
Wow.
saw her doing six um, HyFoSy at that time it was called, because it was
Right.
with contrast, not with foam, and it
Right.
was with contrast, and it was very good. But the technology of the software was still
Clunky.
green.
Yeah.
But so I try, and then I came back to the states, and I tried to
Hmm.
pass through the FDA, the echo beads that could be
Right.
instilled for the heart, could be instilled in the uterus. It
Right.
was a headache. I spent more than 3 years, never made it. And then during the pandemic, I heard that this company, XM Foam, passed through the FDA the foam that it was already approved in Europe. And immediately in
Wow.
22, when we opened Positive, I contacted them and I said, I want to try this. And we start trying it, and it's just a big difference. It's just a big difference.
Wow.
Less radiation, less pain,
Yes.
immediately available.
Yes.
You don't need more technology. You don't need a
Hmm.
fluoroscopy that costs $100,000. You just need an ultrasound that you
Yes.
already have. There
Right.
is a learning curve, no question about it. There is a learning
Hmm.
curve
Hmm.
depending on your skill, anywhere between 5 to 15 cases to get the subtle movement of the probe. But it is easy and more important. So
Let
this
me
the
let me let me
Mhm.
explain to some of our lay
Yeah.
audience what we're talking about. HSG is hysterosalpingogram, when you need to see if the tubes are open. Because if the tubes are open, the egg cannot come out and be picked up in the tube. Sperm cannot go in. This is where the action is. The fertilization occurs in the tube. So we need to know that your
Yep.
tubes are open. And if the tubes are open, the treatment strategy is completely different. I had a
Hmm.
patient who was getting IUIs by another doctor for 2 years.
With the
And when
tubes
she
blocked.
came to see me, tested her, her tubes was blocked. And that was the year she became menopausal. So it's like a double
Oh.
tragedy. So we're talking about, and the HSG is painful, and
Hmm.
they inject a dye, so you may be allergic to the iodine dye, and then they do X-rays to see if it fills the uterus and if it comes out. That's the radiation that Dr. Paco is talking about. So now we're saying that there is a technique to get the same information without the pain, without the dye, without the radiation, right? That's what you're saying.
Hmm. No,
And it gives
and
us the same information.
the same. According to the American Radiology Association,
Yes.
HyFoSy has become the gold standard, the first step. Two, it is um, the same accuracy with the same positive predictive value and negative predictive value,
Right.
sometimes even better than HSG. So it's
Right.
less painful, less
Hmm.
radiation, same accuracy. There's a no-brainer. The thing
Awesome.
is that we physicians, it takes a little bit to change patterns.
Yes.
I don't know if you know this study that was done on the hyperlipidemia and the use of anti-cholesterol drugs and high blood
Yeah.
pressure also. It takes 10 years for the physicians to change their mind for the whole industry.
Right.
So I think that we are in that phase, but I think little by little HyFoSy will replace HSG.
I
the
think
other
so.
the other thing that it happens, which is you know very very common, who does the HSG? Sometimes we fertility specialists, but a
Right.
lot of times is done by radiologists.
Radiologist. Correct.
And with all due respect to my colleagues of radiology, they don't put a speculums every day, and the patients are complaining because it's
They're
uncomfortable.
uncomfortable.
It's
Yeah.
uncomfortable to. It's uncomfortable if we do it. We pay. We have put thousands of speculums a year, and it's
Right.
still we have to be very careful, very gentle, and tell them and use the
Yes.
gel and this and that, and it still is uncomfortable. So
Uncomfortable.
imagine if somebody that has never put a speculum or puts once a year or twice a year,
Hmm.
it's uncomfortable, so they don't like it. The patients complain when you refer them.
Right.
So I
Right.
think that there is these are the reason why patients should
Hmm.
incorporate HyFoSy. But as a even more before
Hmm.
than that, which we discussed briefly, is the
Yes.
fact that what positive tries to do is to look at things
Hmm.
in a much more simpler way. How can we
Right.
remove things from the process? And it's very difficult and very humbling for physicians that have spent 4 years of medicine, 4 years of college, 4 years of
Right.
OBGYN, and 3 of fertility
For
to
yes.
say, a lot of the things that we do not add value. It's
Yes.
very humbling. And
Hmm.
so we try to go to the roots. What was it? Einstein said the things should be as simpler as possible, but not simpler. And what do you need to get pregnant? You need three things.
Exactly.
You need three things.
Yes.
You need sperms.
Absolutely. Yep.
You need eggs. You need a
Yep.
place for them to have a date. That's it.
Exactly.
That's
That's
it.
it. That's the key ingredient. I always tell it's a cookbook. That's the
That's
menu.
it.
That's the menu. That's
So,
right.
what do you need? So, in a traditional fertility clinic, the patients
Yeah.
come in, and because the insurance covers the first visit, you go there and you sit down and explain the physiology of all this, and you don't know anything about the patients. You don't have any test. So then you order your semen analysis to check the sperm.
Yes.
You order the AMH to check
Yes.
the egg quality, the egg
Yes.
quantity, and then three, you do an HSG or a HyFoSy to order that.
Yes.
So what
Yes.
happens is, from those 100 patients, 20 will never convince the guy to do a semen analysis. And
Exactly.
then the ones that 50% of them that come back 3 months or 4 months later because they
Exactly.
delay the HSG, because whatever, um, then 6 months later, 50% of those, because there's no transparency in a lot of the clinics, uh, we have two tools. I mean, we have three tools. We only
Yes.
we only have three things. We either do medication with an IUI, and
Yes.
that's why you want to check the tubes.
Absolutely.
You do IVF, whether
Yep.
you do PGTA or not.
Right.
And 3, if you are with no gametes on either side, you use donor gametes.
Exactly.
That's all. We have 3 tests and we have 3 tools. We can make it as complicated as possible, but 80% of the cases with those 3 things and those 3 treatments, you solve it.
We get an answer. We get an answer.
We get an
That's
answer
it.
90% of the times, and you can implement a treatment. So what we do at
Hmm.
Positive Fertility is we just don't see anybody that doesn't have an AMH. We don't see anybody that doesn't have a semen analysis because they don't show that they are committed.
Yes.
And
Yes.
with that, we do. The transparency of our pricing is also in the website, so people
Hmm.
know how much they're going to spend. And then,
Yeah. And I hope my audience listening to this gets this, because sometimes I feel like I'm almost begging them, please get your test done. Please get
you
your
cannot do
AMH.
anything.
Please do the semen analysis. Please, when are we going to see your tubes? And
Yeah.
you almost have to beg them to finish this, because they don't get the sense that, especially in patients who are over 40, that time is not on their side.
Yeah.
They don't get that.
And no, they don't. And sometimes, to be fair to some patients,
Hmm.
is we know that in the process of grief there is the
Right.
denial and there's the
Right.
other one, and we understand that, but
Right.
the thing is that they should know that we cannot do anything if you don't know
Right.
if you have sperms or not, if they're eggs or not,
Exactly.
and the tubes are open.
Exactly.
So what we have decided is to do those tests and the HyFoSy before seeing us or the first day that they see us. So what
Excellent.
happens is that the people that arrive to us are committed because they already
Hmm.
did the test and fill out the HMP, their history. So what happens is that 100% of the patients on day 1 at our office, they will have a treatment plan.
Awesome. That
100%.
is excellent.
So
That
they're
just
doing
really
IUI.
shaves.
It changes
Yes.
everything. They do an IUI or an IVF,
Yes.
with or without PGTA. That's it. So because everything else, what a lot of people don't get is that in the past, IVF was very expensive, continues to be very expensive. But in the past, it was very
Hmm.
expensive, and the pregnancy rate was 10. I don't know if your audience knows this, but the first
It was low.
IVF,
Hmm.
Louis Brown, was the
Yes.
120th attempt.
To do
Look at,
IVF.
yes. So they
It took that long.
not in the same patient, but
Of
but they
course. Of course. Yes.
but they tried
Different
120
patients.
different
Yes.
patients, 120. So at the beginning in 1989, when I began, being exposed to all this, pregnancy rate was 10%, 15%. It was, and the pregnancy rate per month on a natural basis. So if we have, let's say, let me see, that we have 100 patients that are 30 years of age, and they already had
Yes.
3 babies. No question, they're fertile. And those
Yes.
in those 100 people are ovulating tonight, and we're so nice that we can give them a voucher to go to the JW Marriott to do homework.
Yes.
So, how many of those will end up 9 months later with the baby? And the answer
With the
is
baby.
20. Yeah, 20.
Absolutely.
So, the
Yes.
pregnancy rate is 20. And nowadays, in fertility, we have a euploid embryo. We have 50,
Yes.
60% pregnancy
60%.
rate.
Exactly.
So, we are
Yes.
3 times nature.
Yes.
3 times. We're in a different ball game. So, if we
Yes.
can uh, so doing an IUI with at best will be 15, 17%, something like
At
that,
best.
compared to IVF, makes no sense, but I understand that the cost is an issue. So that's why
Yes.
we said, what's the best treatment out there? IVF, no doubt. So how can we make it more affordable? So let's
Hmm.
remove things that do not add value. The first thing is
Hmm.
to make it closer to a diagnosis. We do all this
Right.
testing. And then we streamline the process. Streamline the process by removing things that do not add value and different protocols that have not proven with any kind of evidence to increase anything. So we simplify the things,
Hmm.
and the pregnancy rate is as anybody else, but
Excellent.
we We do it quick in a much more affordable manner. So this
Awesome.
is where a HyFoSy comes in,
Comes into
the XM
place.
foam, because
Yes.
we do the AMH, the semen analysis, and the XM foam, and boom, first visit they have a
They're
treatment.
pregnant.
So
Awesome.
HyFoSy is such a good tool because now we can do it, and I will encourage OBGYNs out there because it will help them, their patients. It
Yeah.
will probably help them out to have some
I
tools
feel we
that they don't
need to
have.
have an academy and and go out and even tell our OBGYNs colleagues, like we just signed a deal with Kaiser, which is exciting because they get to do all that before they send the patient to me, right?
Yes,
So by the time they send the patient to me, they're IVF ready, and that it's a win-win situation.
absolutely.
It's a joint partnership where they do the workup, so I get to do the heavy lifting, but the preliminary stuff is done. So I
Yeah.
see the patient's ready, boom, we're ready to
Boom.
go. And I think it's even more cost effective for a big organization like Kaiser. They
Yep.
want success, they want it fast. And so when we started talking, it was like, how can we make this partnership work? Why don't we shift a lot of this so that you have an enormous OBGYN staff? We could get them doing some of this preliminary workup. I come in on the end where you're not, track heavy. We get babies.
Yes, and the good news that I'm going to give you is that the academy already exists. It's called
Awesome.
IVFAcademyUSA.com. So we
Ah,
actually have an IVF Academy where we have we have a three IVF Academy have three branches. So
awesome.
the branch, the dean of the laboratory school where we train embryologists and andrologists is Tony Anderson.
Awesome.
Then we have the dean of the clinical school is Dr. Paul Magarelli. Dr. Paul Magarelli has been training people
Yes.
for years and years and years, very
Yes.
expert as a teacher and as a physician. So there we train nurse practitioners, physician assistants, and a lot of people say, "Whoa, why you train them?" Because currently those people are being trained like bricklayers on the job. You know, they get better, but with time. And
Yeah.
here we have a 6 month program where they come like a fellowship, a little bit much more prepared before they go out and help the REIs, because they're not going to replace the REIs. They're going to help
Help.
the REIs to
Yes.
be more effective. And then we
Excellent.
have the nursing program and also the business side, where we teach people leadership skills, everything that I was telling you:
Yes.
operations management, human
Yes.
resources, listening skills, empathy skills,
Hmm.
business skills. So the IBF Academy is already working. You know, you
Awesome.
can go to www.ivfacademyusa.com and we have
Awesome.
all those courses there.
I might send some people your way because I also
Sure.
have a joint training I have a partnership with the University of Maryland to help train their PA students, and the ones that want to
Yes,
go into fertility, I help
absolutely.
groom them, set them up. So that would be a match made in heaven.
Absolutely, and I'm actually working the PA school at the University of Texas Health Science Center in San Antonio. So they rotate with us, and they get just like wow. And we have simulators for ultrasounds. We have
Yes.
simulators for embryo transfers.
Transfers,
I mean, and
correct.
the data is very solid. The data is very solid in Europe, in UK. They've done
Yes.
randomized control trials for
Hmm.
OBGYNs, fertility specialists versus
Hmm.
nurse practitioners and embryo transfers. Same pregnancy rate.
Same. It's a skill. It's a
The
skill.
skill is just,
That is, yeah.
it's difficult. You have to have a
Yes.
learning curve, but there is no reason why a
Hmm.
well-trained nurse practitioner
Hmm.
cannot be as good as a OBGYN or
Right.
fertility specialist on an, they put IUDs, they do endometrial biopsies, they do
Yes.
all this sort of stuff. So but physicians, REIs, us, should not have a scarcity
Hmm.
mentality of fear
Right.
and protection of our industry. No, if we want to serve more people, we need help.
Oh, yeah, yeah, absolutely. I agree
We
with
need
you.
help.
Yeah, we need help. We have to serve a lot, and there's a dire need. 1 in 6 people worldwide have infertility, right?
Yeah,
One in
no,
six. Yeah.
yeah. So
So, so Dr. Arredondo, I've so enjoyed our talk, and maybe you and I can get together in this IVF
absolutely.
Academy thing because I could just see possibilities. One of the things I love to do, I love to mentor. I mentor pre med students, I mentor residents, and now I'm mentoring PA students because I like to sort of be part of the people that mold and shape people as they're coming in so that they can
Hmm.
see how much we care about what we do and hopefully feed some of that love of what we do. I can
Yeah.
just palpate your excitement and your love of what you do, and
Oh
you
yeah.
really have to love it. It's
Yep.
simply a labor of love sometimes.
No
So
question. And
thank
then
you
what I
so much.
no no and what I'm going to do is I think that you should talk to Dr. Paul Margarelli because we need more people to participate. Giving they could be classes like this online. So
Oh,
yeah, no,
absolutely.
and we are
Yeah.
all that's
Yes.
our strength and our weakness. We're passionate.
We're gonna talk. We're gonna talk. So,
Absolutely.
Paco, listen. So, anyone who wants to reach Dr. Arredondo in Texas is
Yep.
Positive IVF. Look him up there, and it's
Yep.
positive with a Z.
Yes. P as in Peter,
Uh
O
huh.
as in Oscar,
Uh huh.
Z
Uh huh.
I
Uh huh.
V as in Victor F.com.
F.
Positive with Z because
Yes.
we are different.
That's right. And you are also on LinkedIn. You're doing great things.
Yes,
I'm so happy that we could have this conversation, and I look forward to collaborating more. So excited.
absolutely.
So excited.
Thank you,
Thank you
Yemisi,
so
for the
much.
opportunity. Take care.
Yes. All right, listeners, you've heard it. If you like what you've heard, like, share, and subscribe. And do look up Dr. Arredondo. He's just
Hmm.
an fascinating, exciting person. Thank you so much.
Thank you.